Hello folks, let's discuss this very interesting case. This is a 60-year-old Latin American female who presents with bilateral visual loss. Fundus examination revealed disc edema, a few white, deep retinal lesions with poorly demarcated margins. There were also exudates and retinal hemorrhages. There were also signs of vasculitis. The patient was taking high-dose steroid for several months for systemic lupus erythematosus. She refers past exposure to cat. The differential diagnosis of this case of a neuroretinitis with hemorrhage and exudates in an immunosuppressed female is syphilis, tuberculosis, toxoplasmosis, Lyme disease, sarcoidosis, a few types of yeasts, lymphoma, or the diagnosis itself. This is a case of ocular Bartonellosis or cat-scractch disease. Ocular Bartonellosis is a rare manifestation of cat-scratch disease, and neuroretinitis is a typical presentation. It's usually caused by infection of Bartonella henselae after contact with cats. Bartonella henselae is a gram-negative aerobic intracellular bacillus. The diagnosis is usually confirmed by positive serologic analysis. In this case, IgG was high. This patient had multiple brain microabscesses, and biopsy of this brain abscess revealed positive PCR for Bartonella. Vision-threatening ocular manifestations can be improved if the cases are mild. Neuroretinitis may affect about 2% of patients with Bartonellosis and is characterized by optic disc swelling and macular star with exudates. Treatment must be done with early antibiotics to try to improve visual outcome and prevent visual loss. Recommended antibiotics include gentamicin, doxycycline, azithromycin, trimethoprim and sulfa, ciprofloxacin, and rifampicin. They all may have good efficacy. Corticosteroids are also a consideration for both systemic and ocular therapy. So this is a case of ocular Bartonellosis presenting with neuroretinitis, vasculitis, and retinal hemorrhage. Keep cat-scratch disease in your differential. See you on the next video.